Welcome back, dear viewers. You're still watching Nile Cruise from Prince Mohammed Ali's palace here in Al Manial in the heart of Cairo. The Health Ministry has affirmed that the presidential health initiatives launched over the past years for the early detection and treatment of a number of diseases has so far supported 86 million people. The initiatives launched under the major initiative of 100 million healthy lives include an initiative to support the health of Egyptian women and an initiative to examine and treat people with chronic diseases and detect kidney disease. This in addition to an initiative to detect and treat hearing loss and impairment of newborns, an initiative to eliminate surgical waiting lists, an initiative to support maternal health, as well as the vaccination campaign, of course, against the coronavirus pandemic. We are honored to host here Dr. Magdy Adly, Senior of Technical Quality and Control in Health Insurance Authority, to shed more light on the significance of these health initiatives. Thank you very much, Dr. Adly, for joining us. It's a great pleasure to have you with us.
Thank you for having me this night, this evening, and I'm appreciate to be with you, and I'm happy to be with you today.
It's a great pleasure to have you with us, Dr. Adly. So, several presidential health initiatives were launched. Would you tell us more about them, and especially that they were taken again by the head of the state, who is keen, of course, on improving the Egyptian people's health?
Okay, if we come to the past, since His Excellency took the post by 2013, he is working 14. Sorry, he is working hard with all institutions of the state in a frame of solidarity, and in a frame of gathering the efforts for improving the health conditions for the Egyptian citizens, even social conditions for Egyptian citizens, economical conditions for Egyptian citizens. One of these important is health sectors. We have a lot of initiatives and campaigns. One of the most famous one is 100 million initiative campaign, and that 100 million initiatives, including many campaigns, starting from hepatitis C campaign.
I want to focus on that, please, because that was very important, because hepatitis C was a major headache for Egyptians for years and years, for decades.
That's right. You know that Egypt in the past suffering a lot from hepatitis C, which have problems reflected on the economy of the state, and maybe we have a record of #1 globally for hepatitis C. And now we are talking that Egypt is free of hepatitis C, and this is a
major achievement.
Yes, a major achievement, and even WHO itself
praised.
That's right, and make it as a global experimental to be transferred to other countries, because we faced a big problem, and we managed to overcome it through like 7 months only. This campaign started by October of 2018. Was the first stage, and the second stage was by the end of February 2019, and we finished that campaign by March or April 2019. 60 million citizens was investigated or were checked up from hepatitis C and make laboratory analysis for them, in addition to the currently chronic disease like hypertension, obesity, kidney failure. Like 2.2 million citizens get a treatment from hepatitis C. And like 92% decrease of rate of infection of hepatitis C. That is a great job, by the way, and the president, Mr. President himself was following that by himself. If we are talking also about campaigns, we can talk about the early detection of breast cancer of Egyptian women, and early diagnosis of the breast cancer of Egyptian women. That campaign targeted like 28 million Egyptian women. And you know that when you discover or detect the disease first in first stages,
Yes.
or in early, it will keep you cost a little than if you go or more farther than
Very true.
the
Yes,
time.
very logical. Yeah.
Yes, and if you ask yourself to determine or to detect the disease first, or to wait for treating or treatment of the side effect of that disease, by 2017
Prevention is better than cure.
yes,
always.
yes, this is right. By 2017, there is a scientific study made by international company specialized in diabetic medicine, in cooperation with Egyptian University in Egypt, for the cost of diabetes mellitus disease in Egypt yearly. They found that diabetes mellitus costs like 25 billion Egyptian pound yearly, like 11% only for medication and 70% for the furthermore side effects of the disease. So to detect the disease from the beginning, that will decrease the cost of
What you spend on in the health sector.
That's right.
And would save money maybe for more research, for more efforts and other initiatives.
That's right, and
Yes.
that is the perfect and perfect vision of Mr. President to discover and detect the disease early and to
Prevent it rather than to wait to cure it.
Yes, that's right.
Dr. Adly, there is also an initiative about eating healthy, nutritious food and leading a healthy lifestyle. I want you to talk to us about the importance of that initiative specifically, especially that unhealthy food is related to obesity, to high blood pressure, to diabetes, and to other major diseases.
As I told you from the beginning, these, which is called currently chronic disease, which like 70% from the disease which is lead to the death in Egypt, is related to one or two, three disease. One of them is obesity, because obesity, when somebody eat non-healthy food, especially fast foods, these fast foods, when come to into the body, increase the rate of or the cholesterol and triglycerides, and these triglycerides and cholesterol
Bad for the heart.
yes, very harmful for the heart, and then it's become harmful to the kidney. So after a little time, you will find the person is suffering from hypertension and suffering from kidney disease and need to make kidney dialysis, and sometimes which is called kidney dialysis, and these are making pressure on the state itself for expenses, a lot of money for to cover the increase of rate of disease in the state itself.
So again, if we work on raising awareness on the importance of a healthy lifestyle, then this is prevention.
This is right.
And this is
right.
better than
the
cure.
awareness is very good for preventing or for to having a good and healthy food is very effective to provide or to be aware from the harmful side effect of that fast foods. And back to the nature is very good, by the way. Even you have a completely meal from vitamins, from elements which is needed by the body, more than fast foods, which is full of cholesterol and fats and so on.
Dr. Adly, how do you personally see the importance of the role of the media, state-owned media like ours perhaps, or social media or private owned media, in raising awareness regarding the health initiatives and healthy lifestyle?
This is a good question, by the way. Social media have a very good and very important role for spreading awareness among the citizens, because you know many citizens, especially in villages, you know, doesn't know a lot about scientific researches or a healthy nutrition and something like that. But if we have, if you use that social media for spreading that, it will increase the awareness among these people. And there is a big problems, by the way, need and efforts of social media, especially which is related for the problem of population and increase in population, especially for the early marriage in village, and these are we suppose as social media and other which is called institution, we supposed to unify to make more spread for awareness about the advantages or disadvantages and the problems which come after from these problems, like something like
the newborns, the
newborns,
children,
and even if a pregnancy happened, there was which is called miscarriage of early pregnancy. And the bleeding of
that would be dangerous for the health of the girl.
This is right. In the same time, this problem especially, it affects on the education, because of like 50% of that girls which marry early have dropped out from education. All of these problems should be negotiated through social media, and our citizens, our people in villages must know these problems, and other problems like family planning, which lead also for the increase of population and and limited the sustainable development of the state. And in that point, merely I'd like to describe and to say that family planning depending on six, as WHO said, depend on 6 ways or 6 methods of contraception. Reversible contraception, which is using IUD or intrauterine devices, hormonal contraception using pills or injection, fertility awareness, and irreversible contraception using vasectomy or tubal ligation. Other, which is barrier contraception using condoms. These informations must be transferred to these our citizens in villages, or our citizens, to increase the health awareness.
You just have helped in that, by the way.
Yes.
You are raising awareness, Dr.
Yes.
Adly. Your
Thank
presence with us is already
Thank you,
raising awareness.
Thank you. Also, if we are talking about the initiatives and that initiatives of environment of the of hearing of
The
children,
newborn babies,
newborn.
yeah. It's good that the initiatives are going to the babies as well.
Yes, yes.
So we are covering.
Covering
We're moving in the
all-
right direction for sure.
All ages, from newborns up to adult or elderly people. Newborn have also, apart from the initiatives, which is deafness initiatives or detection of the impairment of hearing, from year 1 day up to 30 days. And nowadays you will find the certification of birth model having a part of hearing detection problems. These are to determine if that child or that newborn have problems in hearing or not. And like 1,900,008 newborn have been investigated. Even not Egyptian newborn, other newborn from other foreign countries which live in Egypt also contain in that initiatives.
Wonderful.
Yes,
to hear.
like
So-
6,000 newborn from foreigner
Yeah.
countries have been investigated in Egypt here to detect if they have a problem of.
Yeah.
They make that to see if the newborn need to have implantation or of that auditory snails or not, because if the newborn having a problems in hearing, you're supposed to discover that from the first day, so that you can make implantation of auditory snails for him. And by the way, that cost a lot of money for on a state side.
Now, yes, Dr. Magdy, I guess Egypt has had a great success in combating the COVID-19 pandemic, and not only have we kept the numbers down or taken the right precautions at the right timing, but also localizing the production of vaccines and efforts in that domain to serve the region as well, and not just ourselves. Can you talk to us about that big effort?
This is a great, but I'd like to be more to shed more light on something where you
Please.
said, which is localization of manufacturing. Not only for medication, for all as concepts or all aspects of the life in Egypt. Mr. President like to localize what is coming from outside, including medicine and raw material of medicine even, and last time since the crisis of COVID-19. The regional center for manufacturing of vaccine in Africa. And by the way, WHO chose Egypt as one of the regional center for production of vaccines in North Africa and in Africa as a whole.
Yes.
Among six or five countries also. So that helps us for covering vaccination of our citizens and exporting the other vaccines to other African countries. And I'd like to say for that that point, mainly last epidemic week, Ministry of Health published that there was an increase for the infection of COVID-19, like 6.9% of increase of infection. Although the symptoms is still the same, although there is no quarantine hospitals full of people, although there is no increase in mortalities of COVID-19, but we're supposed to be careful about that there is an increase of infected cases, and we're supposed to be having a precautional measurement, especially we are coming for our celebrations, which is there is a lot of people in narrow places having not good ventilation, and that make the virus itself spread in a high rate, and maybe there is another mutations can happen, and that will be a problem. So we thank God we have a low rate of quarantine now, and the low rate of death because of COVID-19 since the beginning of the crisis, but we're supposed to be careful for that.
Well, you have raised awareness again.
Yeah.
Thank you for raising awareness,
Thank
Dr. Adly.
Thank you.
Dear viewers, on that note, we thank on your behalf our dear guest here, Dr. Magdy Adly, Senior of Technical Quality and Control in the Health Insurance Authority. Thank you again for being with us, and thank you for raising awareness. Thank you.
Thank you very much.
Thank you, Dr. Adly. Dear viewers, please stay with us. Nile Cruise will resume shortly. Don't go away.